I have pain in my groin every time I get up. Now, generally, this is called as a round ligament pain, wherein when you're lying down or you're sitting and then you get up and suddenly there's like a catch in your pelvis, in the lower abdomen. You suddenly feel a pull. This is because we have a ligament called as round ligament which supports the uterus. So uterus is like normally this much size, and it is supported by a lot of pelvic structures which prevents it from falling down in the vagina. Because there is that thing wherein the uterus prolapses out as we grow old. Like some of the grandmas will have that, where the uterus is like literally falling out because their support system just disappeared. So there is one of the support system which is called as a uterosacral ligament, which goes from the top of your uterus to the front of your abdomen, and it's literally like has muscles in that ligament. So sometimes it gets pulled when we get up, when we sit down, and it's absolutely harmless. It's absolutely benign, and this sort of pain generally is not treated with medication. So it will keep happening, and it can scare some patients, and we do get a lot of patients with in urgent care with this sort of visit wherein they don't know what happened, and it's absolutely harmless. Now, if you have this kind of pain and there is no way to make it better, so what we generally tell you is like try to just get up slowly, and if that catch happens, just sit down. Let it pass. Of course, some doctors will give their patients a lot of multivitamins and magnesium and calcium, and that can help with the electrolyte balance overall in your body. But this muscle sometimes just gets pulled, and as I said, it's harmless and it doesn't really harm you or the baby, apart from just being one of the irritating things about pregnancy, like Braxton eggs. So it depends on how much is your pain threshold and if you can cope with these sort of things. If you can't cope with these sort of things, then of course get it checked by your doctor. And you can always take a paracetamol, like 2 tablets, stat like 1000 milligrams. That will relieve you of the pain if it's really bad. But round ligament pain is never really known to cause this sort of pain, like for which you need to take painkiller or put some ointment. So just let that pain be. I also want to talk about your back hurting all the time. Now, understand, when we are pregnant, we are suddenly carrying this bag in front of us, and it puts a lot of strain on our vertebral column, the spine, and our center of gravity shifts. So initially, when we can stand properly, we are balancing out. There is a center of gravity in our spine which is normal, and we are our muscles and everything is able to keep us standing. But now we have to put a lot of strain to stand back with that baby in front of us, and this produces a lot of strain on your back. Apart from that, we have a hormone called relaxin which starts secreting in our body the moment we are pregnant, and this hormone relaxin relaxes all the joints. So if you have ever had injuries in your past, back injury, spine, leg injury, knee injury, all the center point injuries, and that injured joint which is not like perfect right now, in pregnancy it relaxes a little bit, and when it relaxes because of relaxin, it hurts. So in my case, I had an injury in my hip once just while climbing, so I throughout pregnancy had this hip pain. Some people will have past babies, so their hips would be like little, there'll be like sacroiliac joint dysfunction or pubic symphysis dysfunction. Those joints have opened up a little bit, so those joints relax even more and cause more pain throughout pregnancy, but they don't affect the baby or you. It's just the pain. So we ask our patients, like some patients it worsens by walking too much, the pain. Then you just need to walk slowly, like take breaks between walks, like sit every 5 minutes. Some people it will worsen by climbing stairs, so don't climb stairs. But at the same time, don't stop doing it after the baby comes out, because we somehow carry forward thinking that the back pain is worsened with it. Also, you can do back stretching exercises like there are a lot of videos on YouTube, and if you want to know some, please let me know. But some back stretching exercises just don't stretch and help you in that moment, and that's fine too. These pains, these aches and pains throughout pregnancy because of the muscles and joints and ligaments, they literally disappear the moment baby comes out. They are gone. This is because the uterus was actually causing all these, enlarged uterus, the big uterus was causing all these aches and pains. Now that the baby is out, nothing to worry. You can go back to your normal life.